So firstly, I'm just going to go through the red tape part of this, which is to say, in the interest of safety, if the continuous fire alarm sounds, please evacuate the room and the public gallery while the stairwells. Do not attempt to use the lifts. Please assemble at Queen Victoria's statue in front of the civic offices. In order to comply with Portsmouth Cultural Trust fire marshal regulations, please remember to sign out when you leave the building after today's meeting. May I draw everyone's attention to the fact this meeting will be live streamed from a camera at a fixed location at the back of the meeting room, and the recording will be live on the council's website. Members of the public are also permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those explicitly stating they do not wish to be recorded. Finally, can everyone use the microphones provided when they are speaking? Okay, so welcome to this meeting for the Health and Social Care Portfolio. First item is apologies for absence.
Councillor Vernon Jackson gave his apologies.
Okay. Declarations of interest. I have no interest to declare. Item 3, learning. Section 75 for learning disabilities. I wonder if one of the officers could say a few words of introduction.
Certainly. Good afternoon, Councillor. This report presented by myself, Acting Deputy Director of Adult Services, and Dominic Dew of the Integrated Commissioning Service is to seek approval of yourself for the extension of the Section 75 agreement for the Integrated Learning Disability Service. And we're looking to extend this for a period of 3 years up until the 31st of March 2021. There's information there in the background that talks about how the service is configured between Solent NHS Trust and Portsmouth City Council, with Portsmouth City Council being the lead provider and working with people with a diagnosed learning disability within Portsmouth or registered with a Portsmouth general practitioner. We have an integrated team that work without formal referral between them and structure their services in the best interests of folk with learning disability within Portsmouth. At 3.4 is the PCCG expenditure for the provision of this service. And just before that, we've got a bit of history around the current agreement, which was verbally extended in December but needed to come here for a formal agreement to that extension. This arrangement is overseen and monitored by the Integrated Commissioning Service, which works between Portsmouth City Council and Portsmouth CCG. And there's, under the reasons for recommendations, it talks about the number of people in Portsmouth with a learning disability and those folk that we work with directly in Portsmouth who have a diagnosed learning disability. The extension of this agreement is to ensure continuity to the current work programmes, which includes an element of transformation of services for people with learning disabilities based on independence and well-being and outcomes around preparation for work and education, if that's appropriate, and purposeful existence, I guess, broadly speaking. We've not been required to provide an equality impact assessment for the purposes of this decision, and the legal comments there enable local authorities and NHS bodies to enter into these agreements, and there are no additional finance implications as this is based on a current spend.
Okay, thank you. And just to confirm, what we've really been asked to do is just to continue arrangements that have been operating for quite some years now.
Yes, that's correct.
Okay, well, unless any of the other officers have got any points, I mean, I think that this is something that's worked well. It has taken out some of the friction which you find in other local authorities between council and NHS arguing about who's liable for which cost, and having people working together in an integrated form is always a good thing. So I'm happy to approve this item. Item number 4 is... Which one is number 4? Integrated Commission. Yes, Integrated Commissioning Service.
Okay. So I won't repeat what's already been said. So this again is seeking permission to extend an existing agreement for existing arrangements for an integrated commissioning service that exists between the Clinical Commissioning Group and the City Council. Has been in place for a number of years. This is an agreement that covers the staffing costs only of that, and we're seeking permission to extend that for a further 3 years until March 2021.
Okay, thank you. Anyone, anything further to add to that? In which case, I will also approve this one. This is quite a good way of working. It's become quite common across local authorities in many areas of the country. I think it has been successful, and I'm happy to see it continue. Item 5, mental health, section 75.
Thank you. I'm representing this on behalf of our senior manager who works with adults with mental health in Portsmouth City Council. We have a Section 75 agreement with colleagues in Solent NHS Trust to provide an integrated service to adults with mental health problems with, living in Portsmouth or registered with the Portsmouth GP. This work is led by Solent, and they are charged with delivering the requirements set out in the Care Act of 2014, which is the main piece of legislation governing social care provision, and providing, similarly to the LD discussion that we were having earlier, both nursing and social work to those relevant people within Portsmouth. We need to update the agreement because it's November 2013, so it is set to be updated and refreshed in line with Care Act guidance. So this is a request to yourself to agree the extension of the current Section 75 for a period of 1 year until the 1st of July 2019. The reasons for the recommendation is it's an integrated service. It avoids referrals between the NHS and the local authority because they work in a single team, and they can also take advantage of clinical line management from each other's service. We were advised that we didn't need an EIA for this particular decision, as there was one charged originally when we looked at this Section 75, and this would have no negative impact on the people that we're talking about working with. The legal implications, the legal advice is pretty much the same as that for the learning disabilities contract, and we can enter into this agreement.
Okay, thank you. Well, unless anyone's any other points, then I'm also going to approve this one. I think it has been, it is a good way of working, and again, quite a number of local authorities have an integrated service in mental health. I'm conscious that the council is a much smaller provider of, the council's share of the total part of mental health and care spending is fairly small. It's mostly on health costs, so it does make sense for this to be led by Solent, and I'm happy to approve the recommendation. And finally, item 6, Better Care Fund.
Thank you. This is slightly different. This is a request to vary the existing Section 75 that covers the Better Care Fund, which, as people will recall, is a aligned set of funds between the City Council and the CCG that has been in place for a number of years. It is a requirement of Better Care funds that we have this agreement in place. The variation is to include additional resource both from the council and also from the CCG. This is existing resource, and specifically around including the IBCF, otherwise known as the Adult Social Care Transformation Fund, integrated personalised commissioning, which is NHS England monies coming to the CCG to pilot new ways of working, and also shared lives healthcare, again NHS England monies coming to pilot, extending shared lives principles to healthcare as well. It effectively increases the value of the pot from 16 million to 27 million. All other aspects of the Section 75 remain unchanged.
Okay, thank you. This is one of these somewhat bizarre ones in a way, where part of this decision is effectively made for us by the Secretary of State, so we have to increase the pooled amount because of the rules around the Improved Better Care Fund and the strings attached to that. However, I also think it's a very reasonable thing to do. I mean, I've said before that it's my view, my hope that later through this year that we can look at some further extensions to the Better Care Fund and a more of an integrated form of commissioning at a strategic level. So I'm obviously happy with this report as it is. I'm happy with the progress that we're making. I think the Better Care Fund is delivering some of the outcomes that we all hope that it would in coordinating, working across health and care and across the whole system. So I'm more than happy for it to continue. So I shall approve that item. And that concludes the agenda. Thank you.